Hey everyone. So, I really hate talking about this really hard stuff. Me and Zena really do want to come here with like fluffy stories of our favorite video games and stuff. You okay?
Sorry, I just had a migraine twinge in my eye. That was a little weird. You can go ahead, Jess. It just got weird.
You sure you're okay?
I mean, it's okay as I'll be.
Okay, we'll try to get through it.
It's not the funnest, just the thing.
Do you want me to restart it?
Whatever you want to do. I like just cringed in frame, so I guess if you want to...
Alright, I'll restart it.
If you want to restart instead of releasing me cringing.
It's okay, I'll restart
or wincing, sorry. There we go, that's the right word.
Hey everyone. So, I really wish we could talk about like fluffy stuff. Like my favorite video games, or, you know, something really exciting happening. Like, I'm really excited for Spider-Man No Way Home. Or The Matrix, or watching The Matrix with our server, or shit like that. But we gotta talk about the hard stuff before we can get to the fun stuff. That is the rule, and this is the stuff that we need to look at. So here goes. COVID-19 surpasses the 1918 flu to become deadliest pandemic in American history. But national population numbers have tripled since then. Influenza killed 1 in 150 Americans, while 1 in 500 have died from the coronavirus. Let's see what it says.
The coronavirus pandemic has become the deadliest disease outbreak in recent American history, with tolls surpassing the estimated deaths of the 1918 flu. According to data from Johns Hopkins University, 681,253 individuals in the United States have died from COVID-19 infections, while over a century ago, the country lost an estimated 675,000 people during the 1918 influenza pandemic, reports Holly Yan for CNN. Many health experts suspect that the COVID-19 pandemic's high death tolls are a result of America's insufficient response to control the pandemic early on despite modern-day scientific and medical advances, and consider the phenomenon a tragedy, reports Carla K. Johnson for the Associated Press. Currently, an average of 1,900 deaths are reported per day in the U.S. Experts suspect the recent surge is due in part to the persistence of the deadlier Delta variant, reports CNBC's Berkeley Lovelace Jr.
So, let's make this clear. Because of the mismanagement by our government and its unwillingness to create mandates and unwillingness to force idiotic, uneducated, and frankly scared dumbasses to actually wear masks, we all get punished. We get to watch grandma and mom and dad and everyone else we care about potentially get sick. And if they happen to be QAnoners or some other dumbass thing, that likelihood goes up immensely, especially if they're not vaccinated. The fact of the matter is that COVID-19 is still ravaging out of control. Despite the drop we had during the initial parts of the vaccine coming out and the Biden administration's early efforts, the fact of the matter is that Delta complicated things immensely. That's just the system. It's complicated immensely, and it's created a situation where this has gotten more virulent, more people are catching it, more people are dying from it, which means it's more likely to create another mutation. There's already Lambda, there's already Mu. I need people to understand very clearly this. I have said this from the beginning, and me and Zena have been clear from the get-go. We are not handling COVID-19 appropriately. Nothing has changed since February 2020. Wear your fucking mask. Get the fucking vaccine, preferably one of the two most effective ones. I think it's Moderna and Pfizer.
But if you've got access to things, just get what you've got access to.
Sure, get the Johnson & Johnson if that's the only thing you have access to. It's still something. But I need you people to understand this, is that this is getting to the point now where people are trying to create like gallows humor over this shit. I'll give you an example. 1 second. r/Herman Cain Award.
Make sure that you're not logged in.
I don't think I will be.
Okay, good.
So, let me show you guys this real fucking quick. Where did it go? You know how we always talk about this idea that there's like people basically like find a way to try to survive this stuff and try to be as okay as possible? The simple fact of the matter is that there's an entire fucking subreddit called r/Herman Cain Award. I'm not going to go through it in case it violates TOS, but literally this is just a thing talking about people who fucked around and found out. Kat Black's covered this on her channel. No joke. People literally fucked around and found out, and their entire stories from Facebook can be found here. From them saying how Trump is the greatest hero that's ever been, to them being on a ventilator. Yep, Nebraska's decided that. A lot of Republican states have decided that. Like, this is the reality of what we're facing. Right? So let's move on. We got to get through it, folks. You have anything you want to add real quick?
No, this is our usual wear a mask. Even if it's weird, even if you've got to be the only one. Wear a mask when you go out to the grocery store. Keep a mask with you when you go walking and there's people around.
Yep. Wear a mask. Yeah, wear a mask.
Even if you're vaccinated, still wear a mask.
Dunk on conservatives. Wear it when you're just walking down the street. I don't fucking care. The fact of the matter is that we do not know what's going to happen with this. This is still bad. And this isn't to hype up fear. This isn't to keep people terrified or whatever other bullshit conspiracy theorist comes up. It's simply that this is bad. The fact that there's an entire morbid subreddit talking about the death of these people because they can keep finding examples means that this is something that's happened regularly. The only positive thing out of it that comes from it is I've seen people show family members of these poor dead individuals or the people who just barely survived go, get vaccinated. I was wrong about all this. Like, again, they fucked around and found out.
My friend's boyfriend's family is having a hard time with COVID right now, and it's really rough hearing that. Like, these are really wonderful people, and they're really cool, and it
really fucking sucks.
Yeah, I like people, and I don't want anyone to have to go through like losing family members. That's horrifying. Like, especially on such a large scale like this. And even if they do live, like having to live with the potential repercussions from COVID. Like, no, this stuff is horrifying, and I want our community to be safe. I don't ever want to just lose any of you randomly.
You know, that would kill me to see someone on our Discord suddenly just not be able to post anymore and not to know anything. That would be awful.
Yeah.
All right, let's keep going.
It's generally known around the world that America didn't do a very good job in the early stages of controlling the pandemic.
That's not a guilt trippy. I love it.
A medical historian at the National Institutes of Allergy and Infectious Diseases, to Helen Branswell for Stat News. The 1918 flu, also known as the Spanish flu, spread worldwide during 1918 and 1919. In the U.S., it was first identified in military personnel in the spring of 1918 and mostly affected children less than 5 years old, adults between 20 to 40 years old, and seniors 65 years of age or older. Mortality rate was high in healthy people between 20 and 40 years old, making this a unique and devastating feature of the influenza virus, per the Centers for Disease Control and Prevention.
Marionette, please don't make me giggle when I'm trying to listen to horrible things. I do not need Nick Cage references in my head. I love you, but damn. But yeah, I mean, we're talking about one of the most awful flus in the history of the United States that was devastating to seniors and children. It crippled this country as far as I understand. It was devastating to everything about us, and it was the go-to to compare any pandemic to. Well,
when looking at two separate pandemics that occurred in different time periods, understanding the context of all technological, medical, cultural, and social advances that occurred over the past century is important, reports CNBC. American population numbers were vastly different. In 1918, the population was less than a third of today's at 103 million people living in US right before the 1920s. Now, there are 303 million people living in the country. So, while the 1918 flu killed 1 in every 150 Americans, COVID-19 has killed 1 in 500 people so far, per CNBC. Globally, COVID-19 has taken the lives of 4.7 million people, whereas the 1918 pandemic killed an estimated 20 million to 50 million people. When looking at the national population level data during the two events, the 1918 influenza still tops COVID-19, per Stat News.
But just like LeBron James was trying for Michael Jordan's title, it's coming. It's coming for it. That's the one sports thing I know. That's all I got. My point is that the fact of the matter is 1 out of 500. Think about that. Yeah, Rosanna, unironically, I am genuinely of the opinion, like, I am not an authoritarian. I'm a big fan of liberty. I'm a big fan of freedom. I'm also slowly becoming an authoritarian because of these people. When your views are so ignorant and so incapable of understanding facts.
Well, it comes back to, like, hurting children, right? Like, at a certain point, like, we've got to make sure kids don't run into the street, right? And this is, oh God, we got to make sure that adults don't, like, run into the street and die too.
Yeah, absolutely. Yeah, no, Kira, you're right. That's the Spanish flu's end of season numbers. It's not COVID's not done with the season. It's like mid, hopefully. Could be in the beginning. Fuck if I know. We could be dealing with this thing till we're fucking 80. Jesus Christ. Anyway. You okay?
I need to get migraine meds, and it is just enough out of my reach that I
give me that and get up real quick. While Zena's doing that, we'll listen to the next part. Meow.
Medicine was also not as advanced during 1918, and a vaccine against influenza was not available, according to CNN.
True, Tiamat.
To control infections a century ago, non-pharmaceutical interventions like isolation, quarantine, use of disinfectants, cloth masks and limits of public gatherings were enforced, according to the CDC. However, COVID-19 cases are still rising despite the availability of vaccines and other modern medicine practices. Currently, millions of Americans have still not been vaccinated, per CNN.
So real quick, let's talk about that. So we'll look at the United States because we always got to be United States centric because we're terrible. But like, let's look at this. This is the thing. So this is the covid19.healthdata.org. Got this from one of our lovely mods, Lil. And here's the thing. $783 reported COVID deaths is the scenario projected right now for January 1st, 2022. Daily deaths. Oh, we had a little drop. Oh, yeah, it's literally 1,900. I hadn't checked it in a minute. Oh, it did drop a little bit. That's good. Vaccine coverage. 1 dose, 62%. Fully vaccinated, 54%. As you can see here as I move over. Oh,
water.
There you go.
I don't have any left.
That's okay. And I got this here too. Try drinking that stuff.
Yeah.
Let's look at this. This is hospital resources. Daily infection rate. Oh, this is the one that always makes me want to cry. This is mask usage, right? So universal mask usage, the use target would be, what is that? 95%. This is where we're at right now. This is as of the 12th. 41% observed. Yeah, this is insane. And look at this. All projections show that not changing. If this keeps flattening out and staying the same, and if this doesn't improve, we are never getting out of this. Right?
Remember, we're still counting, Morenz tells Stat News.
True.
In 1918, the pandemic became not so deadly within 2 years. We have no idea, I don't trust anybody who says they do, where this COVID-19 will go. Epidemiologist Stephen Kissler from the Harvard T.H. Chan School of Public Health suggests that another reason for high rates of COVID-19 infection is from the misinformation that spread through the internet, per CNN. The truth is we have no historical precedent for the moment we're in now, writes Howard Markle, the director of the Center for History of Medicine at the University of Michigan School of Public Health, last month in The Atlantic. We need to stop thinking back to 1918 as a guide for how to act in the present and to start thinking forward from 2021 as a guide to how to act in the future.
I couldn't agree more. Let's be super clear about all of this. First off, the 1 in 500 has been reported by CNN, by Smithsonian. This is what's happening. The Delta variant is fucking deadly, and it is causing problems. And conservatives don't give a shit. And when they do, they want to take horse dewormer. My compassion on this is running out very quickly. I don't give a fuck about freedoms. When it comes to existential damage and threat to people around us, like, no, we have a social responsibility to not do harm. Wear a fucking mask. It's not that deep. Get the vaccine. Millions of people have gotten it, and spoiler alert, it's at least the Pfizer one has been approved by the FDA. There is no reason not to. And yeah, it's better than bleach or hydroxychloroquine or every other fucking get-rich-quick bullshit thing. The fact that the governor of Florida wasn't drug out in handcuffs when it was found that he had a conflict of interest with making money off of COVID treatments is fundamentally insane to me. So I need everyone to understand this. Tell the people around you, the people that you love, the people you associate with, wear a mask, get vaccinated. If they won't, this is one of those few times where I would emotionally telling them, it's either you do this or we don't interact anymore. I don't call on ultimatums that long often because I think they're toxic. But the simple fact of the matter, in my humble opinion, is that these things do harm. All right? You have to make boundaries. And if it comes down to your health, if it comes between you and the people that you love versus someone else getting upset and butthurt over the fact that they have to actually be a responsible adult, yeah, the fact is it doesn't matter. Hurt feelings don't matter. They do it, or you shame and get the fuck out of there. Simple as that.
Just a friendly reminder, in the US, the vaccine is free and widely available. It is safe.
You can get it at a fucking pharmacy. Holy shit. Also, I'll double down on this. Get your fucking flu vaccine. Jesus Christ.
That too.
All right. Thank you so much. We'll see you in the next one. Hey, everybody. Thank you so much for watching. If you like this video, please like, comment, and subscribe. You can also ring the bell if you want to be notified of our videos. If you want to help the channel, you can donate at streamlabs.com/transgirltherapist/tip. You also can become a patron at patreon.com/transgirltherapist. For as low as $3, you can support our channel. Thanks for watching.